Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we'll be talking about the comprehensive services available for breast cancer treatment at the Karmanos Cancer Institute at McLaren Port Huron. Joining me now is radiation oncologist Dr. Matthew Johnson. Dr. Johnson, thank you for joining us today.
Thanks for having me.
Now let's start with what is breast cancer?
So in general, breast cancer is when there is an abnormal, uncontrolled growth of cells in the breast. And these cancers can be very heterogeneous from one person to the next. One person may have a very indolent, slow-growing cancer, and another person's cancer may be more aggressive. But in general, they're an abnormal growth of the breast's normal cells.
What are the recommendations for screening for breast cancer?
So there's actually slightly different guidelines depending on which service you talk to. The American Cancer Society guidelines are pretty widely used, and what they recommend for women is at age 40, women should talk to their primary care doctor about screening mammograms. They can actually start their annual mammograms at age 40. By age 45, women should be doing mammograms either annually or biannually, and they should continue doing that as long as they're in good health. And those are really kind of the general recommendations. It is also recommended for women to have a clinical breast exam, usually done by the primary care doctor at least once a year as well.
Now, how is breast cancer diagnosed?
That's a good question. Usually what will happen is either it'll be found on an imaging study, like a person who goes in for their mammogram and has something abnormal found, or oftentimes if a person feels something or notices something, their doctor may send them for a mammogram, but typically mammogram and ultrasound are both used to examine the breast, and if there is an abnormality found, at that point the radiology doctor will have a biopsy performed, typically what we call a core biopsy, so that they can get a little core of the tissue to analyze under the microscope. You know, in some cases, patients may, if there's concern that there may be disease outside of what we're seeing on the mammogram, an MRI of the breast is also an option that's available.
Now, once diagnosed with breast cancer, what are the treatment options available?
For the most part, the main treatment of breast cancer usually involves surgical resection of the tumor, and that's followed often by, you know, either radiation therapy. Usually comes after the surgery. Some patients, if they have a more advanced presentation, will get chemotherapy either up front or after the surgery. And oftentimes, many patients will also be recommended to have a kind of pill treatment after this is all done that helps to block the hormones that stimulate breast cancer to grow.
Wow, that's pretty involved. What determines the course of treatment for each woman diagnosed with breast cancer?
So that's a good question. And what usually happens is at the time someone is diagnosed, typically after the radiologist orders the biopsy, the patient will be referred to meet with a breast surgeon. At this point, usually the breast surgeon will also send the patient to meet us in radiation oncology as well as the people in medical oncology. Together, our specialties all come together. We review the case with the radiologist during our tumor boards, and we help to come up with an individualized plan for each patient. You know, some patients, especially if they have very early stage disease, may just go to surgery right away. Some patients may be recommended to have chemotherapy before any kind of surgery. But those plans are really crystallized when we have our tumor board discussions.
Can you tell us a little bit more about what the tumor board is?
Sure. So the tumor board is a group of doctors who meet typically around once a week to discuss the different cases. We have specialists from radiology, radiation oncology, surgery, medical oncology. We also usually have supportive staff such as nursing, social work, and we review all of the patients' cases, looking at all of the different studies that have been done, and as a group we come up with what our collective treatment recommendation would be.
Wow, that's great. That's truly a multidisciplinary approach. Doctor, this has been great information. We need to take a break. We'll continue in a moment.
Okay, great.